Hi, my name is Jen, also known as JT. I'm one of the nurses that work up on the second floor here at OakLeaf. I'm also one of the joint venture educators. Our goal today is to help you feel prepared and ready for your upcoming joint replacement. Our plan for this class will be to start by providing you with a brief overview of our hospital and to discuss what's in the joint venture mailing you received at the address you provided to us, what you can do to prepare for your upcoming surgery, tips for caring for yourself at home. The majority of our information we're discussing today is also found in the joint venture booklet you received in your mailing. I highly encourage you to read through that booklet after you've watched this video. There's a lot of very good information in there for you and your loved ones to read through and to absorb prior to your surgery. OakLeaf Surgical Hospital is a physician-owned surgical specialty hospital. Over 650 patients have joint replacements performed here each year. I would like to introduce you to Dr. Crow.
Hi, I'm Austin Crow with Triple Valley Orthopedics. I'm one of the orthopedic surgeons here at OakLeaf Surgical Hospital. In 2019, we received a distinction as a Joint Center of Excellence for total knee and total hip replacements. This is a reflection of our care for patients and patient safety outcomes. We are one of the few facilities in the state to receive this distinction, and it's a fact that we're very proud of.
So each one of you should have received a mailing from OakLeaf that contained the joint venture booklet along with the Start Clean Cleansing Kit. We will be talking about this kit a little bit later. Like I said, we highly encourage you not only to watch this video, but to also read through the booklet with your family and loved ones. Let's start the joint venture journey by discussing how you can prepare yourself for your upcoming surgery. A successful surgery requires that you take an active role not only in your preoperative care, but also your postoperative care following your surgery. You've already taken the first step in preparing for your surgery by watching this video to help you learn what you can do to be more ready for your joint replacement. One of the first things that'll take place is scheduling a pre-op appointment with your primary provider. This appointment should take place within 30 days of your surgery. During this visit, they will review your health history, perform a physical exam, order blood work, do an EKG to check your heart rhythm, and possibly order a chest x-ray to make sure you're healthy enough to have surgery and complete your recovery process successfully. If you've had any immunizations recently or plan to have any, those will need to be discussed with your provider as well as your surgeon, especially if it's within 2 weeks of your surgery. You can also expect during this visit that your primary provider is going to discuss with you any medications you are taking at this time, whether they're prescription medications, over-the-counter medications, herbal medications, vitamins, or supplements. They are also going to discuss with you any medications that you may need to stop prior to your surgery. Some examples of these medications would be anti-inflammatory medications such as Advil, Aleve, or ibuprofen. Other examples of medications that you may need to stop taking prior to surgery would be anticoagulants or blood thinners such as aspirin, Coumadin, warfarin, Plavix, Xarelto, or Eliquis, to name a few. Your provider will go over these medications with you and instruct you when to stop taking these medications. He or she will also discuss with you if you are taking any blood pressure medications or diabetic medications, how to take them before surgery. Please take note of this at your appointment and take them appropriately. In order to reduce the risk of infection to your new joint, plan on seeing your dentist at least 4 weeks prior to surgery for any dental work or cleanings you need to have done. Your surgeon will inform you at your post-op visits when he or she is okay with you returning to the dentist following your surgery. In order to decrease the risk of infection to your new joint, antibiotics may be required prior to all post-operative dental procedures and cleanings. Other ways to prepare for your upcoming surgery include the following: quitting or cutting back on nicotine use, eating well, and exercising. If you use nicotine products, cigarettes, e-cigarettes, vaping, chewing tobacco, to name a few, please consider at least cutting back prior to your surgery. Nicotine reduces the size of your blood vessels and decreases the amount of oxygen in your blood. This can lead to increased risk of scar formation and reduced joint mobility after surgery, which can lead to further and future medical interventions. If you quit using nicotine before surgery, you'll have a better joint mobility and increase your ability to heal. Your booklet has more information regarding your health benefits of quitting nicotine use, as well as a list of resources that may help you quit. Nutrition before surgery is just as important as nutrition after surgery. Eating a well-balanced diet that incorporates protein and fiber is very important to help with wound healing and also to help prevent constipation. Including items such as fruits, vegetables, meats, nuts, eggs, and even a protein shake will be very beneficial in helping with your recovery process. Also, drinking plenty of water throughout each day will help prevent constipation. For those of you who have diabetes or have been told that you are borderline diabetic, doing your best to maintain stable blood sugar control prior to surgery will play a significant role in your healing process and reduce your risk of developing an infection after surgery. In this next video, one of our physical therapists, Amy, is going to review a few exercises you can do prior to surgery to help develop muscle memory.
Hello, welcome to OakLeaf Surgical Hospital. We are excited that you will be joining us for your total joint surgery in the future. I'm here today to tell you a little bit about physical therapy and what you can expect with your time at OakLeaf Surgical Hospital. After your surgery, you'll come up to the second floor where a physical therapist from our team will be taking care of you. We will guide you through exercises, icing, elevation, walking, and climbing the steps. We will ensure that you are safe and ready to go home when you're ready. We have groups of exercises that we're going to show you today in preparation for your surgery. We also have groups of exercises that you will do for your specific surgery after your surgery. Those differ a little bit based on your surgeon and based on the surgery you had, but you can expect handouts to come for those in the future. Today, we will be showing you how to do those exercises, how to walk with both walker and crutches, as well as how to climb up and go down the steps to get in and out of your house safely. All right, we are going to teach you a few exercises that we want you to do before your surgery. So there's 3 exercises that I'm going to instruct you in today that I encourage you to practice a couple different times per day leading up to your surgery. So let's start with the first one. It's ankle pumps. So on both of your feet, I'm going to have you bring the toes up towards your nose, just at the ankle joint, and then point down and away. And then go ahead and bring them up again. You want to do these with a little speed because the thought is that you're reducing the risk of a blood clot and you're also helping move some of that fluid from your lower extremity. So a little speed is good, not too fast. And again, all we're trying to do is build some muscle memory in preparation for you doing these exercises again at home after surgery. Good, go ahead and relax. Second exercise is going to be for the quad muscle. So the quad muscle is on the top of the thigh. It runs from the hip to the knee. I'd like you to go ahead and tighten up that muscle and push your knee down into the bed or the mattress, wherever you happen to be laying, and then relax. And then go ahead and tighten and push down. Hold for 3 to 5 counts and then relax. Let's do a couple more. Go ahead and tighten and push down. Now, we don't want you to experience any pain with these, so if you have to back off on your intensity to avoid pain, please do so. Go ahead and tighten, and then relax, and let's do one more. Tighten, and relax. Great. Third exercise that I want you to do today is the heel slide. So the heel slide helps promote range of motion at both the knee and the hip. So we're going to have you bend your knee and slide your heel on the mattress up towards you. Just glide that heel right along and then go ahead and straighten. Reach that leg all the way down and away. Go ahead and bend your knee, slide your heel up to either you're feeling stretch in the knee or the hip. Go ahead and come down. If you need to at home, you could put a plastic bag or a cookie sheet or something with a little smoother surface if there's too much friction on your mattress or sheet. Go ahead and come up and then down, and let's just do one more. Bend that knee up, slide that heel, feel that stretch up in the joints, and then straighten it back out. Those 3 exercises will get you started. Once you get to the hospital after your surgery, we will add to them and give you a few more, but this should get the process started on getting used to exercises and getting that brain-muscle connection working together.
Approximately 2 to 4 weeks prior to surgery, you're going to receive 3 different phone calls from our OakLeaf Surgical Hospital team members. These calls may occur in any order: chart prep nurse, pharmacy, case management.
Hi, my name's Corrine. I'm a chart prep nurse in the pre-op department, and we will call you. You'll receive 2 phone calls from us. The first one will be a 15-minute phone call to ask about your history. Takes about 15 minutes, as I said. And the second phone call is the business day before your surgery. We go just call to give you your arrival time and when you need to stop eating and clear liquids. Both calls We will leave a message if we don't reach you directly. We ask on the first one for the 15 minutes that you call us back. If you do get a voicemail, make sure you leave a message. Sometimes we play some telephone tag because we spend a lot of time on the phone. And the second call, if there's questions, feel free to call us too. Our business hours are 8 to 4:30, Monday through Friday.
Hello, my name is Wheeler, a pharmacist here at OakLeaf Surgical Hospital. There are two primary times when you're going to be talking to a pharmacist here. One is going to be prior to surgery, and then one is prior to discharge. Up to 2 weeks prior to surgery, you'll get a call from either myself or one of my colleagues to go through a current medication list history from you. This list will include both prescriptions and or over-the-counter medications that you're currently on. It'll include herbal, dietary supplements, and or vitamins. We're going to want to know the name, the strength, and then what time of day you take everything for those medications. OakLeaf Surgical Hospital will provide most of the medications while you're here. Generally speaking, we're going to ask that you not bring any medications in with you. If we do ask you to bring any medications in with you, we ask that you give them to the preoperative nurse so they can get them to us in the pharmacy. Home medications are not allowed at bedside. That way you don't self-administer or duplicate any medications while you're here or take any medications that your doctor or surgeon wouldn't want you to take immediately after surgery. If you have any questions with regards to that information after the phone call, don't hesitate to give us a call back at 715-895-9443 during normal business hours or 715-895-9470. One of the most common questions we get on these preoperative phone calls is with regards to what you can and cannot take prior to surgery. Unfortunately, we are unable to provide any recommendations or give advice with regards to that. We ask that you get that information from your primary care provider or whoever does your preoperative physical. A good time to ask that question is at your pre-op physical. If you've already had that preoperative physical, I would recommend that you would give them a call and ask them what you should do with your medications prior to surgery in terms of what you should and what you should not take leading into surgery.
Hi, I'm Kayla. I'm one of the case manager discharge planners that work in our case management department here at OakLeaf Surgical Hospital. Our overall goal is to assist you in returning home. One of our case manager discharge planners will call you about a week or so before your surgery to complete our case management assessment. This call will likely take between 5 and 10 minutes. During this call, we will discuss discharge plans consisting of discharge preferences, your home setup for your recovery, durable medical equipment, who will be available to assist you throughout your recovery, your pharmacy lab and outpatient physical therapy location preferences, and advance directive paperwork. Advance directives are legal documents that communicate a patient's healthcare wishes. Some examples include a living will and or a power of attorney for healthcare. These are explained in more detail in your booklet. We also have copies of advance directive paperwork for anyone interested. If you are not physically and or medically able to return home, our case management team will assist you with choosing the best option for post-acute care. Some examples would include a skilled nursing facility, a swing bed, and home care. Transitioning to post-acute care will be based on skilled physical therapy needs, medical needs, insurance requirements and authorizations, and facility acceptance. One of our case manager discharge planners will plan to meet with you throughout your hospital stay. If you have any additional questions or concerns, case management can be reached Monday through Friday from 8 to 4:30. Please call one of the numbers listed in your booklet. Thank you.
Hello, my name is Becky and I'm a patient financial specialist at OakLeaf Surgical Hospital. Prior to your surgery, our pre-registration department will verify your insurance and work with the schedulers at Chippewa Valley Orthopedic to make sure your surgery is approved by insurance. After your surgery, we will send a claim to your insurance on your behalf. This is for OakLeaf Surgical Hospital facility fees. The surgeon and the anesthesiologist will send in claims for their services. If there are any personal balances after payment by your insurance company, you will receive a statement in the mail. If you need to set up a payment plan, you can call us to work out an agreement. At any point during this process, if you have any questions, feel free to reach out to us. If you have any specific questions regarding your policy, I recommend calling your insurance company directly. I look forward to working with you and hope you have fast healing.
There are many things you can do prior to surgery to help prepare your home. Consider the following suggestions to help promote comfort and safety when you are returning home. It's important to have a proper and comfortable chair on the main level. This chair should be firm and have arms. This will be helpful when you are getting in and out of your chair. Your feet should not dangle while sitting. Attempt to have your feet flat on the floor by using a cushion or a footstool if needed. Your hips should be slightly higher than your knees. This is required for some hip replacement patients and a comfort measure for all patients. Other things that will be helpful when you return home will be keeping frequently used items easily accessible near your recovery space or area. Also removing any tripping hazards, including rugs or extension cords. Consider installing nightlights in your hallways and/or bathrooms, and grab bars near your toilet or in your shower will also be very helpful. Cleaning your house, putting clean linen on your bed, and preparing meals ahead of time. It is important to arrange for someone to help for the first few days after surgery. They can expect to help with driving you to and from appointments, assisting you in and out of the shower, caring for your pets, collecting your mail or newspaper, and taking care of your yard work. Keep in mind that within 2 weeks prior to your surgery, if you have any of the following issues, please notify your surgeon at Chippewa Valley Orthopedics immediately. Things you need to notify your surgeon of are if you have any new cuts, scrapes, rashes, sores, ingrown toenails, new or recurrent infection, a dental emergency, metal allergy, immunizations if your primary care provider has suggested you receive them, a recent fall, or any symptoms of the cold, flu, including fever, sore throat, or any recent antibiotic use within 2 weeks prior to your surgery. Any of these issues could potentially affect your surgery, so it's very important to address these concerns with your surgeon beforehand to make sure that you can safely continue your journey. To reach your surgeon, please call Chippewa Valley Orthopedics at the number provided to you in your booklet. 3 days prior to surgery, you are going to start taking your pre-op surgical shower using your Start Clean Cleansing Kit. Each one of you receive this kit in your joint venture mailings. This kit includes not only the 3 sponges and the surgical wash, but also an instruction sheet on how to perform the showers. On this sheet, it also has the days of the week listed, and it has X'd on there when you should start taking your shower if you have any questions regarding that. The purpose of this wash is to help decrease the risk of infection. With that being said, we discourage patients from shaving their legs 3 days prior to surgery or once you start taking the shower. You'll be expected to take your first shower 2 days prior to surgery. Your second shower will be the day before surgery, and your third and final shower will be the morning of surgery. So as I said, your Start Clean Cleansing Kit has a total of 3 sponges and 1 bottle of surgical soap. With each shower, you're going to use a new sponge and a third of the surgical soap. Please follow these steps with taking your shower. Initially, you should wash your hair with your normal shampoo and conditioner and rinse well. After that, please wash your face and genitals with your normal soap and water. Once that is finished, you're going to take your first sponge with the first third of the surgical soap and apply it to your body from neck down, front and back, and let it sit on your skin for 60 seconds before you rinse it off. Once you rinse it off, you should always use a clean towel and put on clean clothes. Note that once you start taking these surgical showers, you should not be shaving your legs, and you should also not be applying any lotion or creams or powders to the areas that you apply the surgical soap to. This soap is for external use only, so please make sure to keep it out of your eyes, ears, and mouth. Please note that the day before your surgery, you're going to receive your call with your expected arrival time and when you need to stop eating and drinking. If your surgery is on a Monday, you'll be called on a Friday. If you have not heard from one of our OakLeaf team members by 2 p.m. the day before your surgery, please call and inquire. Please take your medications as directed by your primary care provider with a small sip of water. You're also going to take your second pre-surgical shower with your Start Clean Cleansing Kit. Please remove any nail polish, acrylic nails, false eyelashes, any jewelry that you do not need during your stay here, piercings, etc. Please do not use any lotions, creams, or powders to the areas you use the surgical soap on. Use the list included in your book regarding what to pack for your stay here to make it more comfortable for you. The list also reminds you to bring your advance directive if you have it available to you. On the day of surgery, you're going to take your third and final shower. This day, you are not going to apply any lotions, creams, or powders anywhere. This also includes makeup. Please brush your teeth. Remember, do not eat or drink anything the morning of surgery beyond the times you were given by your preoperative nurse that called you the day before. This includes not having chewing gum, mints, hard candy, or nicotine products. Doing so could ultimately delay your surgery or cause it to be canceled. If you've been instructed to take medications on the morning of your surgery, it is okay to do so with a small sip of water. Please plan to arrive on time to OakLeaf Surgical Hospital. You will enter through door 3 as shown on the map in your booklet. You will check in at the front desk. Please have your insurance card and photo ID with you. One of our staff members will escort you to a private room to verify your name, address, insurance information, and planned procedure. When this information has been gathered and is complete, they will escort you back to the lobby where you will eventually meet your pre-op nurse.
Your pre-op nurse will meet you in the lobby and escort you back to the preoperative area where you will get ready for surgery. At this time, due to COVID restrictions, family is not allowed to accompany you back to the pre-op area. This is an example of a preoperative bay. This is where you will get ready for surgery. You can expect to change into a hospital gown and get settled in. Your preoperative nurse will go over your home medication list with you. You will verify the last time you took those medications, your drug allergies, what to expect for surgery, and the last time you ate or drank anything. You will also go over your health history with your preoperative nurse. Your preoperative nurse will take your vital signs. You will have a glucose reading taken. You will have some labs drawn if necessary and an EKG done if necessary. Your nurse will start an IV and will administer your preoperative medications that are ordered by your surgeon. These medications prevent infection and assist you to wake up more comfortably after surgery. Your operative site will be prepped and clipped and wiped down with a pre-surgical scrub. You will speak with your surgeon. They will make a mark on your surgical site and you'll have the opportunity to ask them any questions that you have about the surgery. You will also meet the anesthesia team. You will sign consents for the surgical procedure itself and for the anesthesia. You will meet your operative nurse prior to going back for surgery. Our team will be happy to assist you and to answer any questions you have throughout the process. Your loved one will be contacted as soon as you go back to surgery and throughout the surgical process. They can refer to the transfer board in the lobby.
Hi, I'm Dr. Irwin. I'm one of the anesthesiologists with Chippewa Valley Anesthesia Associates that provides anesthesia services to OakLeaf Surgical Hospital. It is our goal to work with you after reviewing your personal medical history and your personal choices to come up with the best anesthetic for you. For your total joint surgeries, there are two options that you'll have. One, a general anesthetic, and two, a spinal anesthetic. And for some of you undergoing total knee replacement, your surgeon may recommend a nerve block, an adductor canal block for that. A general anesthetic is the anesthetic that most people think about when general anesthesia is thought about. For that surgery, you drift all the way off to sleep. You don't remember anything. You won't feel anything during surgery. What an anesthetic looks like is when it's time for you to come back, we'll bring you back into the operating room, help you move over to the other bed, and after hooking up our monitors, we'll have you breathe some oxygen through a mask. I'll then drift you all the way off to sleep with medications in your IV. Once you're deep off to sleep, we'll put a special breathing tube in the back of your throat. We are the experts in the hospital putting those tubes in. There's still, though, very small chance of hurting teeth, hurting gums, hurting soft tissues in the back of your throat. Most likely thing, a little pinched lip where that tube gets taped. You notice anything different in your mouth, though, afterwards, more than a pinched lip, we want you to let us know. You will also have a little bit of scratchiness in the back of your throat for about 1 to 2 days that we really can't do too much about. For that reason, we'll take it out at the very end of the surgery. We'll also be giving you some pain medications, anti-nausea medications during surgery. That being said, if you come out in the recovery room, if you're feeling pain, you're feeling sick, please let us know. The second option for anesthetic is a spinal anesthetic. The spinal anesthetic is a small shot that goes in your lower back that makes you numb from about here on down. It usually lasts for about 3 hours. To put a spinal in, we'll bring you back to the operating room, we'll help you onto the OR table and have you sit on the OR bed. After putting our monitors in, we'll give you some sedation through medication in your IV. We'll talk you through every part of it while we're placing the block. Anytime we poke it with a needle, though, there's always risks. Always a risk it'll hurt when it goes in. For that reason, we give you some sedation medication, and we also numb it up with a little poke and a burn, kind of a little bee sting. I've had patients that don't even remember us placing the spinal, but most people are very comfortable when the spinal goes in. Anytime I poke you with a needle, there's always risks of infection. For that reason, We wear sterile gloves. We prep your back sterilely widely. We drape it sterilely. We wear a hat and a mask. I've never personally had an infection doing these. Always a risk of hitting a vessel, causing bleeding, hitting a nerve and causing nerve damage. If those things were common, we would not be doing these. What is common is a block to last about 3 hours and then slowly fade off as we watch that in the recovery area. There is also a chance of, it's usually a less than 1 in 100, and a more recent study even showed it to be less than a 1 in 1,000 chance of a special kind of headache afterwards. If you get that special kind of headache, we take care of it, we make it better. About 95% of our patients are having a spinal anesthetic for their anesthesia. They've been very, very happy with their spinal anesthetic. One of our goals for you is to start rehabilitation as soon as possible after your anesthetic and recovery. With a spinal anesthetic, you're much less likely to feel sick to your stomach, more likely to be clear-headed, less likely to be confused, and most importantly, be able to start rehabilitation in a meaningful way as soon as possible. The Joint Commission also points to studies that are showing people with a spinal anesthetic request less pain medication over the first 24 hours than people that have had a general anesthetic. They also point to studies that show a decreased 30-day mortality rate and also a decreased length of stay in the hospital for people that have had a spinal anesthetic versus people that have had a general anesthetic. So for all these reasons, this is one of the reasons that we have a majority of our patients requesting a spinal anesthetic. Once that spinal anesthetic is in, we do help you get into a comfortable position for your surgery. And then once you're comfortable in the position that you are, we have you breathe some oxygen through a mask. There's no breathing tube. You'll be breathing through your own nose and mouth. And we give you sedation medications through your IV. I always tell people that you might remember little bits and pieces of surgery, sight, smell, or conversation, but a majority of our patients don't remember anything. You will be snoring and snoozing throughout the surgery and probably not remembering anything. But I always remind people, one of us is always with you right at the head of your bed, watching the monitors, watching your body language to make sure you are safe and comfortable. After surgery, we'll bring you out to our recovery area just to make sure that the spinal is wearing off nicely and you're doing okay before we have you go on to the second stage of your recovery. If your surgeon has decided that an adductor canal block would be a good option for you, we will talk to you about the risks and benefits of an adductor canal block. There are two main nerves that bring pain sensation from your knee up to your spinal cord and brain. One is a sciatic nerve that runs down the back of your leg. That brings pain signals from the back 1/3 of your knee. The majority of your pain during knee surgery and total knee replacement will be more in the front 2/3 of the knee. That is controlled by the femoral nerve. In the past, we've blocked the femoral nerve way up in the groin area. However, we noticed that the front muscles of the leg were affected and the leg would be weak for rehabilitation afterwards. For that reason, we target a branch of the femoral nerve, the saphenous nerve, that usually runs through the adductor canal. This block, I always tell patients, is probably the easiest block that we do, both for the patient and for us. It's a very quick block. What we do is we take ultrasound, we take a look at that little adductor canal, and we quickly put a needle down into that canal. The worst part of the whole thing is when we inject the numbing medication to flood that tunnel so the nerve that goes through that tunnel is saturated and numb. Anytime I poke you with a needle, there's always risks. Always a risk it's going to hurt. For that reason, we give you sedation medication before we even start. Always a risk of infection. Once again, we wear a hat and a mask. We wear sterile gloves. We prep you sterilely, and we will also use a sterile ultrasound sheath to make sure that infection is low. Personally, I've never had an infection doing these that I've known about. Always a risk of hitting a vessel, causing bleeding. You'll most likely have a little pin poke where that needle goes in. Bruising is extremely rare. Always a risk of hitting a nearby nerve and causing nerve damage. Once again, if those things were common, I would not be doing these, and I can guarantee that your surgeon would not be even having us talk to you about them. What is common is a block to last approximately 18, even up to 24 hours. It can last up to 2 to 3 days, although that's extremely rare, but if that lasts that long, wonderful. Hours can last less than 18 hours. Not work at all is rare, but the worst case scenario is we will work some additional pain medications in to make sure that you are comfortable afterwards. Of course, you might have additional questions that I haven't addressed here. And so if you do, please know that one of us will be happy to talk to you with any questions or concerns that you have on the day of your surgery.
Your operating room nurse will meet you in the preoperative area. They will ask you some of the same questions that you've already been asked to ensure patient safety and verification purposes. This includes verifying that the surgeon has marked the correct operative site with his or her initials. The operating room nurse will escort you to the surgical suite, introduce you to your operative team, and go over next steps. You may notice many people and various pieces of equipment in the room. This is completely normal for total joint replacement surgery. Please don't hesitate to ask any questions if you have them. Your surgical team will be with you through the entire procedure to ensure patient safety. Once your surgery is finished, your operating room nurse and anesthesia team will escort you to the recovery area.
Hi, I'm Nancy, one of the nurses in the recovery room. In the recovery room, you will be monitored by our highly skilled nurses, nursing assistants, anesthesia providers, and respiratory therapists. They will continue to care for you in this area until you've met our established criteria for transfer to the second floor. Usually it's about an hour, hour and a half. When you arrive to the recovery room, there's going to be a flurry of activity around you while we hook you up to our monitors and get report from the operating room. Depending on what type of anesthesia you had, you may wake up with an oxygen mask over your face or one of the nasal cannulas in your nose. As you become fully awake, you may notice some of these symptoms: blurred vision, dry mouth, nausea, chills, discomfort, and if you had spinal anesthesia, numbness to your lower body. Your care team will do everything they can to minimize these symptoms and to help alleviate any discomforts you may experience. In the recovery room, we will also obtain any x-rays if needed. The SCDs will be placed on your lower legs and the Iceman will be started. For the privacy of all our patients, friends and family are rarely allowed back into the recovery room. Our nursing staff will do their best to keep your friends and families updated. Usually staff will reach out to them after you've been with us about 30 minutes.
Once you've met the criteria in recovery room, your recovery room nurse is going to escort you up to the second floor suite in your bed, where you will meet your nursing staff and team members that will be caring for you up on the second floor. Initially, they will take about 15 minutes to get you settled in the room and do a handoff report. Once that is complete, nursing staff will go find your family, loved ones, whoever may be here with you if you prefer, so they can come and be with you in your room. So as I said, once you reach the second floor, you're going to meet multiple different staff who are going to be caring for you during your stay. Those will include nursing, CNAs, physical therapy, case management, pharmacy, respiratory therapist, your surgeon, his assistant, and also a hospitalist. Your surgeon, his or her assistant, along with the team members I mentioned prior, and your family will consist of your care team that is going to help decide what is going to work best for you upon returning home. We will be working together on figuring out what is the best discharge plans along with medications that will help you with your recovery and journey following your surgery. Your surgeon and his assistant are going to manage your post-operative pain, and they will also be writing your discharge instructions when you are ready to go home. The hospitalist will manage your medical conditions and your home medications while you're here in the hospital. They will also resume your medications upon returning home. Note that some of your home medications may be stopped for a short period of time depending on what your surgeon has ordered. We encourage you to actively participate in the following methods to help prevent blood clots after surgery. One of them being the ankle pumps that Amy talked about during her physical therapy segment. That is basically where you're pumping your feet back and forth, helping increase circulation and help prevent blood clots after surgery. We encourage you to start doing that as soon as you are able to after surgery. Another item which will have started in the recovery room is called an SCD, or a sequential compression device. This is a Velcro wrap that will be placed on your calf, connected to the device over here, and what that does is it's going to pump air through here and massage your calves both at the same time and help increase circulation. You will wear these while you are in bed, as there's quite a few cords and we don't want to have any tripping hazards when you're up in the chair. These are used only here in the hospital. The last device is called a TED hose, or a compression stocking. This is something that you'll be wearing for about up to 3 weeks once you are discharged and are at home. I do have a device here that I'm going to teach you about right now that'll help you assist putting them on at home with your loved one. Basically, this little silk sleeve you're going to put on your foot, and it's going to help whoever is with you sneak that TED hose past your heel to a point where you're able to reach it and help pull it up the rest of the way. They come in 2 sizes. One is knee length and one is thigh length, and it really depends on what your surgeon has ordered for you. Your surgeon will also order a specific blood thinner or anticoagulant that's specific to you after surgery. We will not know what this medication is until you are on the 2nd floor and have received your post-op surgical orders. This is a medication that you'll be taking on a daily basis here in the hospital, and also once you are home for the time that your surgeon has ordered it for. There are multiple different medications. That's why we're not going to educate on all of them right now. Some examples are warfarin, Coumadin, Plavix, aspirin, Eliquis, Xarelto, just to name a few. You still may require some oxygen therapy once you are on the 2nd floor. Initially, when you arrive, or depending on your medical conditions, if you have sleep apnea, etc., you may need it for short intermittent periods of time throughout your stay. So as you had maybe had in the recovery room, you still may have the mask in place, helping give you extra oxygen, or you may still have the nasal cannula in place also. If you do have a sleep apnea device at home, we highly encourage you to bring that here to the hospital with you, because that will definitely help get that oxygen moving through your body and help promote healing to your surgical site. An important part of your recovery is keeping your lungs nice and open to help promote healing and help prevent post-op complications such as pneumonia. So regular deep breaths followed by coughing will help promote opening up your lungs and help your oxygen travel to your surgical site. Another tool that might be given to you by your respiratory therapist may be in a device that looks like this. It's called an incentive spirometer. What this does is it's a tool that helps you measure how far you're opening up your lungs. We encourage you to use it 10 times an hour. You use it by putting this plastic piece here in your mouth. You suck on it like a straw. It'll move this blue disc up, giving you the measurement of how far you're opening up your lungs. If respiratory therapy decides you would benefit from this tool, they will give it to you and educate you on this here in the hospital. Whether you're doing deep breathing and coughing or using the incentive spirometer device, you're encouraged to do this 10 times an hour, whether it is here in the hospital or at home for at least the first week post-op. So anesthesia talked to you about the 2 different types of anesthesia we offer here at OakLeaf. Depending on which option you chose, you're going to have different requirements when you arrive to the 2nd floor. The majority of our patients have spinal anesthesia, so do not be surprised if you have the spinal anesthesia if you come to the floor and you still cannot feel your legs, or if you're only able to move your legs just a little bit, or if they're feeling heavy. It will take a little bit of time for them to wake up. We'll be frequently monitoring you, seeing how well you're able to move your legs. We're also going to be monitoring your heart rate, blood pressure, oxygen levels with different types of equipment that we have here at OakLeaf for the first several hours. If you had general anesthesia, you may experience some nausea, or you might be more sleepy, meaning that you might have more requirements for oxygen for a short period of time. Once you're awake enough and safe enough to attempt to sit on the edge of the bed and stand, we will be getting you up to start your walking and test out that new hip or knee that you just had placed. One of the last areas to wake up after a spinal anesthetic is your bowel and bladder. With that being said, some of our patients will return to 2nd floor with a catheter in place, which helps drain the urine out of your bladder while it is still sleeping. Once you're able to get up and walk safely, that catheter will be removed. Constipation is also a concern after surgery. Because of this, we'll be starting you on a stool softener in your room the night of surgery. We also encourage you to drink plenty of water and trying to increase your fiber intake. Once you are feeling well enough, we will have the kitchen come up and take your order. Your first meal, we encourage you to order something light, maybe soup and a sandwich. We could always let you order something more later. We do have our fancy menus here at OakLeaf, and the kitchen will come directly to your room and take your order right here. Our surgeons request that you sit up in the chair for meals and that you also are dressed the morning after surgery. Our goal is to have you up and walking in your rooms and in the hallways within the first 4 hours after arriving to the 2nd floor. Our surgeons have actually requested this and find that it actually benefits your recovery and helps you get the best outcome possible. Some things to note when you're up walking: we do ask you to bring your walker and crutches into the hospital with you, as we will make sure that they're fit specifically to you and that they're safe to use. We will be using what we call a gait belt. This is just something that the nurse or care team can put around your waist, and it gives us something actually to hang on to in case if you become unsteady when you're up walking around.
All right, we are going to teach you how to use that walker after your surgery. So we're going to move the walker a little bit forward, and then I want you to move your surgical leg and then your good leg. And I want you to move the walker and the surgical leg and the good leg. And repeat that process. And no matter what distance you're walking, bedroom to bathroom, anywhere in the house, to and from physical therapy, you're going to use the same process over and over. Walker, surgical leg, and then your good leg. Let's just take a couple more steps. Yep, one more. Great. That should be able to get you wherever you need to be in your house. All right, we are going to show you how to use those crutches once you get home. So I'm going to have you move the crutches forward, surgical leg, and then the good leg. Yep. And you can put as much weight on that knee as you feel comfortable with, okay? Good. And come forward, crutches, surgical leg, then your good leg, crutches, surgical leg, and good leg. Just try a couple more steps here. Practice that pattern. No matter what distance you're walking, the pattern stays the same. There you go, one more step. Nice job. All right, we are going to teach you how to get into your home safely. So I'm going to have you grab that railing on your right side, and I'm going to give you a cane for your left side. We're using this setup just simply because your railing is on your right at home. You could also use a crutch in this hand if you had access to a crutch as well. So to go up the steps, you're going to go up with your good leg first. So push up onto that step, bring your surgical leg, and now bring your cane. I'll have you go up with your good leg again. Push and bring your cane up. And then I'll have you go up one more time. Good leg, surgical leg, cane. All right, let's walk across that platform. In a couple days, you're going to head out for physical therapy. We want you to be able to get out of your house. So let's go down with the cane, down with the surgical leg, lower yourself down, and then the good leg, and then the cane, the surgical leg, and the good leg. All right, now go ahead and just stand there. I'm going to grab your walker for you. I'm going to give you your walker. I'm going to take your cane, and we're just going to walk with the walker. So you're going to do walker, moves forward, surgical leg, and then good leg, and then walker, surgical leg, and good leg. And you just repeat that process. So walker, surgical leg, good leg. And you're allowed to put as much weight on your leg as you feel comfortable with. Go ahead and just take one more step. There we go. All right, we are going to teach you how to get up those steps to get into your house. So we're going to go up with your good leg first. So push down on those crutches, good leg, now surgical leg, and now bring those crutches up. Okay, bring your, good leg, surgical leg, and then your crutches. You don't have to have your knees bent quite that much. You can step up with that leg, stand up tall, there you go, and now bring your crutches. Okay, come across that platform. I'm going to teach you how to come out of the house. So when you're coming out of the house, or you're going down to your basement or your lower level, you're going to put the crutches down, your surgical leg, and then your good leg. And your crutches, and reach that surgical leg out, and then your good leg. And then for walking with crutches, it stays very similar to that. You're going to move the crutches forward, surgical leg, and then good leg. And crutches, surgical leg, and good leg. And go ahead and just practice a few steps like that. Yep, a couple more.
A couple of the devices to talk about while we are on the second floor suite here is an ice machine. This is a machine that is going to be placed on you in the recovery room, and it will be going home with you. What this does is it circulates cold water to this pad, and it'll be helping with your comfort and also helping decrease swelling during your recovery period. To use this, since this item will be going home with you, I'm just going to kind of show you a couple tricks here. Put the ice in first. There's a line on the inside that you'll fill the ice to, and then you're going to fill it to that line with water. Once that is done, you're going to place the cover back on here, and then you will take this cord and you will plug it into the back of the machine here. There's just a little hole in the back, and then this part here plugs into the wall. There's no on and off switch to turn it off. Basically, you can either unplug it from the wall or from the back of the machine, or you can just take the ice pad off. As far as how the ice circulates through, or the cold circulates through, once it's plugged in, the machine's going to start making some noise, and it's going to be pumping water through this cord into the pad. You will know when to change the ice out when the pad is no longer cold. A couple things just to point out with this machine. From history, we've found out that these two little metal knobs here, you always want to have them pointing away from each other. If they're pointing in or pushing themselves in, it can leak cold water, which makes for a very, very cold spot to be sitting in. When you connect these, if you ever disconnect this and reconnect it, you should hear a click. Just to note, when you're putting this ice on, whether it's your knee, hip, wherever it hurts, you always want to have a towel, a pillowcase, something in between the pad and your skin so it doesn't get too cold. This ice is going to be very important to your recovery. You're going to be wearing it all the time here in the hospital, and you can wear it as much as possible at home. Anytime you have pain, your first go-to should be putting the ice machine on. You also want to use it actively before or after physical therapy or doing your exercises at home. You'll also be receiving IV fluids and antibiotics through the IV that was placed in your arm down in the pre-op area. Once your antibiotics are complete and you are well rehydrated, we will disconnect the IV tubing from your arm, and once we have a discharge plan in place, we will remove the IV from your arm. Some of you may return to the floor depending on what your surgeon decides with a drain in place. The purpose of this drain is to remove any excess fluid. It helps decrease swelling. It's kind of hit and miss if we see them, so I can't guarantee if you'll have one or not. This will be placed near your incision. It's not sutured in, and your nurse will remove it in the morning after your surgery, sometime after 4 a.m. There's a good chance you're also going to have blood work drawn the morning after your surgery, depending on what your surgeon and hospitalist have ordered. This will be drawn either by lab or your nursing staff, depending on who's available at that time, and the results will be available in the morning when your surgeon and hospitalist round. It's important to know that pain is a natural part of your healing process. With that being said, we here at OakLeaf have a pain menu and multiple medications and multiple other methods that we utilize to help promote comfort and find a tolerable level of pain to help you with your recovery. Once you arrive on the second floor, our goal here is to use oral medication as needed. As soon as you are able to start eating, we're going to be assessing your pain level. Remember, our goal is to not have you be pain-free, but it's to help find a tolerable level that you can manage. There are many different things we can use here at OakLeaf aside from medication to help control your pain. One of them being the ice machine that I talked about. Another being getting up and walking, as that can help stretch those muscles and help loosen things up, along with position changes. Distraction is also a very good method to use, especially maybe once you've taken the oral medication and you're waiting for that to kick in. So we will look at the orders that your surgeon has provided for us and figure out what is the best method for you, whether it be medications, ice, distraction, getting up and walking if you're able to at that time, repositioning, maybe visiting with your family just to take your mind off of things. This is our pain assessment tool that we use here at OakLeaf. As you can tell, it has multiple different ways for you to visualize and communicate your pain levels to us. We have the face scale, we have the mild, moderate, severe, and we also have the numbers below that give description of what your pain level is at. Our goal here is, like I said before, to help you find a tolerable and manageable level of pain using multiple different methods. It's very important for you to communicate where you are on the pain scale with us and let us know if your pain is becoming unmanageable prior to it becoming out of control, so we can help you figure out what to do best to help promote your comfort. Along with managing your pain, there may be other new medications that your surgeon or hospitalist may prescribe for you while you're here at the hospital. Our pharmacist will be here and will meet with you directly in your room and discuss any of these new medications that have been prescribed to you during your hospital stay.
At this point, we're going to talk to you about newly prescribed medications. Some examples of newly prescribed medications are going to be pain medications, anti-nausea medications, constipation prevention medications, and last but not least, anticoagulants, which can help reduce and prevent the risk of developing blood clots at discharge. At discharge, you'll have a list of medications for both new, resumed, and discontinued medications. Please reference that list of medications. If you have any questions with regards to any new medications or discontinued medications, don't hesitate to give us a call back at the hospital. Our phone number here, 715-831-8130, and you can ask for a nurse or a pharmacist.
The majority of our patients discharge the day after surgery. This decision will be made collectively by your surgeon and care team members, including you and your family. Our goal is to have you safely return home. There will be a few steps and things to consider that your surgeon will be looking at to make sure that the appropriate discharge plan takes place. The morning after surgery, your surgeon and his or her assistant will see you in your room. They're going to review how your recovery process is going, answer any further questions you may have regarding your surgery, and write discharge orders. You'll also be seen by physical therapy. Physical therapy is going to go through all the exercises you'll be expected to perform at home with you and your loved ones. They're also going to review walking in the halls, how to go up and down stairs, getting in and out of a vehicle, how to get up from a chair, different devices that might be useful for you at home to make your recovery process smoother. They will also help decide if you are safe to return home. A few other things that need to take place prior to your discharging home is all your antibiotics will need to be completed, along with any other scheduled meds that your surgeon or hospitalist has ordered during your hospital stay. Most of our patients discharge home between 10 a.m. and 12 p.m. Physical therapy starts seeing patients as early as 7 a.m. We will know the time of your physical therapy session the evening before. It would be very good to have your family member or loved one here to be here for the physical therapy session, along with all the post-op discharge instructions that we'll be going through. Not only for a second set of ears, but also a second set of eyes, because they might pick up on things or see things that you are not registering at that time because of medications, or maybe some anesthesia is still in your system. Before we end, we are going to show you a few slides. The first one being what a normal versus arthritic knee x-ray looks like. So a normal knee, as you can tell, there's quite a bit of space in between the femur and the tibia. That is somebody who has a very healthy knee and no arthritis. Whereas the second picture on the right shows a very arthritic knee joint. It's very white, there's not much space in there, and you all know what that feels like if you're having a total knee replaced. This is a frontal view of a total knee replacement. You'll have the femoral component along with the tibial component and the plastic liner. This here is a picture of the side view, including all those components and what your kneecap will look like. For those of you having a hip surgery, this is what a normal hip x-ray will look like in somebody who's young and healthy. As you can tell, there is no white or grayed out areas in between the hip socket and the head of the thigh bone. All of you had an x-ray taken before surgery. You've seen them in your surgeon's office. You've seen all the breakdown of the cartilage with the white grayed out areas, as you can see on the before x-ray. This after x-ray is showing you what your new hip replacement will look like. So this is what a total hip replacement looks like. You'll have the acetabular component that goes into your hip socket. Then you'll have the plastic liner that acts as your cartilage, along with the femoral head that attaches to the femoral stem, which goes into your femur. At your pre-op surgical visit with your surgeon, he or she may have recommended you getting a pair of cross compression shorts. This is what they look like. They prefer the brand McDavid. You can purchase them at Northwoods Physical Therapy, which is connected to Chippewa Valley Orthopedics. They go by underwear size. They will be very tight fitting. We recommend going up a size from what you wear in your underwear. The purpose of them is to help create compression, which reduces swelling and promotes healing. Thank you for choosing OakLeaf Surgical Hospital for your joint venture journey. If you have any questions after watching this video and reading through your booklet, please reach out to us using one of the numbers provided within the booklet.